Welcome to Glencoe's Health eSpotlight video series, where real-world connections help you develop the skills for a healthy future.
Sun worship is just part of life for most teenagers.
I really like being in the sun.
Lazy days at the beach, perfecting the golden tan is what summer is all about.
It makes you look better.
Yeah.
Unfortunately, all that sun is making something else a part of life for the young: skin cancer. Dermatologists like James Spencer, who once thought skin cancer in a 20-year-old was extremely rare, is now seeing it routinely.
When I did my training, which wasn't so many years ago, skin cancer was really a disease of older people.
Recent figures suggest melanoma rates among people aged 15 to 29 are up 50% in the last 25 years.
It's this alarming rise in younger and younger patients. It's really, truly a huge public health problem.
Young people under pressure to meet today's ideal that says tan is beautiful are simply spending more time in the sun. And most don't know how to use sunblock properly, applying it only once instead of several times a day. Many are suffering from the mistaken notion that burning is bad, but a tan is healthy. Nothing, says Dr. Spencer, could be further from the truth.
When you develop a tan, that is your body's response to cell damage.
Deaths from skin cancer are down, but few young people realize the disease can also scar. Geraldine Kelleher knows how scary that can be.
I was shocked.
She had her first lesion removed at 20 and a second one taken off just this week at age 34. The experience has left its mark.
Actually, it's doing okay.
I'm cured, but I need to be careful.
Doctors admit their biggest challenge in preventing skin cancer is simply getting kids to care today.
I guess, I think I'll just worry about it when I'm older.
Not to ruin a good day at the beach, but by then, doctors say, it may be too late.
Chronic bad breath can be an embarrassing problem, but it can also be a symptom of a more serious medical condition. Dentist Dr. Nancy Rosen is here to tell us what causes bad breath and how to stop it. Good morning.
Good morning.
What are the leading causes of bad breath?
There are a couple of different causes. One would be lifestyle habits like smoking, chewing tobacco, alcohol consumption. Another one would be medical problems. If someone has diabetes, stomach problems, sinus infections, medication that someone would take.
So sometimes bad breath can be a sign of or a symptom of or just
it could be a sign of
something that is more serious than I ate Chinese food last night.
Exactly.
Right.
But the most common problem is that someone has a dirty mouth.
Right. And so let's talk about things you can do to make sure that you don't come to work in the morning and make people uncomfortable by sitting next to you. All right. How effective are mouthwashes in treating this stuff?
You know, you have to be careful with the mouthwashes. You want to make sure that the mouthwash you are using is alcohol-free. A lot of the mouthwashes, like let's say Listerine or Scope, they do contain alcohol, and if you are using them, you need to dilute it because the alcohol actually dries out the mouth.
Right.
And bacteria love that. So you want to try alcohol-free mouthwashes or mouthwashes that have like zinc in it or eucalyptus or menthol. And there are a lot of them out on the market.
What about the good old-fashioned toothbrush and toothpaste?
You need a good toothbrush.
Right.
I love the Power toothbrushes. It eliminates a lot of the plaque, and plaque is bacteria, and the bacteria is what causes the bad breath.
Right, but if you're really serious about this, you've really got to do the old, and since you're my dentist, floss, 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 right?
Yes, and you also must scrape your tongue. If you're not scraping your tongue, you're still going to have bad breath.
Are you okay? Now we're doing the segment like it's my problem. I guess maybe someone's trying to tell me. I've never seen these things. What is this? These tongue cleaners? What do you do with that?
Tongue scrapers.
Yeah.
Well, if you want to demonstrate, you could stick your tongue out as far as you can.
Yeah.
And you're going to put that back and just push it down and scrape. And that actually gets a lot of the bacteria off.
What do you do with it when you're done with it?
You rinse, actually.
Oh, okay. Gee whiz. So you floss and you scrape your tongue. And what about gum and mints? I mean, can't that help?
It can, but certain mints or gum will just mask the problem. Again, you don't want to use anything that has sugar in it. You want to use sugar-free or parsley, in your case, that will neutralize the acid in your mouth.
Dr. Nancy Rosen, thank you so much.
Thank you.
We're very enlightened now. Tongue scrapers for everybody.
Music is Christopher Wood's vocation. He's a musician and training to be a sound engineer, but at just 21, his hearing has already been badly damaged. The cause? Playing in bands, going to noisy gigs, and listening to his MP3 player.
As a music tech student and a musician, and hopefully someone who's going to work in the music industry in the future, it's pretty critical. Your ears are your best tool, and the damage is permanent. I've been told that the hearing will never improve, and this ear will get worse a lot faster when I get older than my left ear will. So it's something you've got to deal with, and many people who've been working in the industry for a long time actually have a sustained level of hearing loss, and it's too late.
So how loud is too loud? Well, at the moment, the music we're listening to is at around 60 decibels. At 80 decibels, it's obviously much louder, but you can still make out what I'm saying. But at 90 decibels, I really have to shout to make myself heard. And it's at this level that the noise is potentially damaging over a prolonged period, and you really should wear some of these. Earplugs are used by many musicians, but the Royal National Institute for the Deaf says redesigning them as a must-have accessory might persuade more clubbers to wear them. It says they're at particular risk because of the length of time they're exposed to the music.
In clubs, you can get noise levels over 100 decibels, and you could only safely be in that sort of noise level for less than 2 hours a week.
It's not seen as rock and roll to wear a pair of earplugs, you know what I mean? But at the end of the day, it's your ears, you only get one pair of them. It's an attitude change that needs to take place. I mean, if you could get disposable ones at clubs or something, you know, something simple like that, just a change of attitude.
At Birmingham Conservatoire, the use of earplugs is encouraged among students. Christopher now always wears his, but he regrets not doing so when he was younger.
You've been watching Glencoe's Healthy Spotlight video series. Remember, be healthy, choose wisely.